Hi, this is Dr. Risha Sharma. I'll be talking about holistic approach to autism. I hope most of you have joined now, and as you will be joining, I'll be giving more insights about how I approach autism and what do I do. So we will start first of all with uh, who am I? Okay, you need to know why am I talking about holistic approach to autism. So I am an Ayurvedic doctor. Um, my basic degree is in Ayurveda. I'm an Ayurvedic physician. And then I went on to do naturopathy, then functional medicine training in Singapore for 6 years. And our approach has specifically been in gut health management for all kinds of disorders and autism spectrum disorders. So, uh, I think in India, I've been working for a while now with autistic kids, and it's been 10 years in practice. And in the last 2 years, I've been exclusively working in India with autistic kids and with children in Singapore, offline and online, and obviously around the world. I've worked with patients from Southeast Asia, um, India, US, UK, Australia, a lot of South Asian countries, more than 30 countries. I've met people from different racial backgrounds and patients from all different backgrounds. And it's funny that a lot of patients in India ask me, um, is it the same outside India? Yes, autism is a condition that can happen to anybody, and it's a disorder, it's not a disease, and this can happen with anyone, with anybody's child. So obviously, can happen in any part of the world. So, getting that out of the way, coming back to how I started working with autistic kids is I started working with specifically autistic kids in Singapore in 2016, starting 2016, where I started working in a naturopathic clinic there. It's called Sundardas Naturopathic Clinic, and it is one of their best, uh, by far, I think the best. We've been awarded about 3 times for being the best autism clinic in Singapore for holistic approach. And so there I got hands-on training and expertise and exposure to autistic cases, children with on the spectrum with different challenges, mild, moderate, severe, different grades, ADHD, SPD, and GDD, and things like that. So that is how I landed up this life today. And if you find my Instagram handle, which is the same name as my clinic in Chandigarh, which is Wishful Healing Clinic, my handle on Instagram also is Wishful Healing, and so is my page on Facebook. I think it's tagged here in the live. You can find it on Facebook. And that's where I talk about autism, how to approach autism holistically, and what are the holistic approaches that work, and hands-on experience. And you will find a lot of parents interacting on that page about their individual challenges in their journey with their child with autism, and how things change and how much of a holistic approach helps. So, coming to what is a holistic approach? There was a question a few days back, somebody asked me on Instagram that you keep saying holistic, holistic, holistic. What does it mean? Holistic means this approach towards a disorder or any health condition. I'm not talking about autism right now. So, any gut health condition or any health condition which needs to be approached via gut is a concept that is common to a lot of alternate therapies or Ayurveda, naturopathy, functional medicine. They all believe in healing the body inside out. So when we start healing the body inside out, the controller of all this function is your gut. So this gut is what is gut? Gut is all the way starting from your mouth down to your anus, the whole lining of your intestines, stomach, digestive system. All of these contribute to what we call as the gut. So when we work on the gut, we are primarily targeting intestines, that is your large and small intestine, and all the organs associated with your alimentary canal, which is your digestive tract. So our approach in Ayurveda, naturopathy, functional medicine is all about encouraging healing from inside. So all the approaches, be it therapies, diet, lifestyle, supplements, counseling, um, sleep issues, disorders, anything that can impact an imbalance in your gut has to be addressed. So this is holistic approach. We are not only just giving you medicines or supplements to treat your body or get you better. We are trying to make your life better overall. So the whole idea of my page's name, Wishful Healing. Hi, Chris. So the whole idea of holistic healing is that you get an experience wherein you improve holistically, and we approach, say if you have 5 symptoms, your eyes is aching, then you also have a headache, there is some pain in your neck also, and then you have some digestive upset also. If if you go to a regular medical doctor, they might send you to a gastro, an eye doctor, a migraine doctor, and so on and so forth, which is not wrong. I'm not contradicting modern approach here. So uh, our approach is that we try to look at it all together. Why are these symptoms and how are these symptoms connected? And most often we land up in the gut. Most of the time, there is not one, there's rarely any condition where you will not find a gut connection to your symptoms or signs. So same applies to autism as well. So this was a little bit of background about the holistic approach. And so I have been working with autistic kids since 2016 in Singapore and now in India. And we use Ayurveda, we use naturopathy, we use functional medicine to approach treatment management for autism. So coming to how it is helpful in managing autism spectrum disorders, because it's not a disease. So why at all a treatment approach or a management approach? So a long-term goal is to give meaning and purpose, not give, at least help our clients achieve some purpose, right? Some sense of purpose of their life. You can leave an autistic child be and not do anything about it. A lot of parents who are in denial, or they have just given up, that they don't want to do anything about it. They just let the child be the way the child is. I think they are taking away their child's right for a purpose in life. So our basic approach towards doing anything with an autistic child is to help them achieve more functional independence and some purpose. And that purpose will come when they are able to focus better, when they are able to communicate better, when they are sleeping better, when they are eating better, when their sensory issues are manageable. So if by an approach that helps them address all these issues, makes their life more sorted, more predictable, more routine oriented, and more purposeful, why not? And I think that also, as a parent who is looking for some direction in this regard, like I think I have most of the parents so far I've met who have a child on the spectrum, they are very, very tired, very, very scared, and very, very clueless about how to approach their child's life, the child's approach and management of the condition. So this whole journey of approaching autism through holistic means is getting the basics right first. So we work with the diet of the child, whether if the child has sensory issues, we address those through different ways. We work on the brain through craniosacral therapy and brain and the spine to work on the skeletal restrictions. We work through supplements, we work through herbal medicines, Ayurvedic potent herbs, powders, which are not only children friendly, but also very, very effective. So this combination is giving great results. So every child is different, every case is different. So a 3-year-old and a 13-year-old with same challenges will have a very different approach. So depending upon how old the child is, the approach changes. So every case is unique. So if you ask me what is the, like every day I get this message on Instagram that, can you tell me a herb that will help my child? Can you tell me a supplement that I can give my child to improve his focus or concentration or diet? I can't, because every child's approach is different. like every child's needs are different. They may have different deficiencies, different level of toxicity, different sensitivity. They, just like we are all unique individuals, every autistic child also has a unique need for, a routine, for even if we say that some things are common, like an autistic child, autistic children thrive on routine. They need predictability. They need the same food every day, and then they get very anxious in a new environment. So anticipatory anxiety, these are commonalities, but still, when you look at an individual autistic children, you will find different approach, different challenges, or different demands that need to be met to help them make their life easier. So approach towards autism is that, because whenever I talk about autism, a lot of people jump the gun and think that, why are you offering a treatment for autism? I say, I am not offering a treatment. I am not calling it a disease. We are just trying to, make the child functionally more independent. If the child is not potty trained, we work with the parents to help them achieve that. If the child is not eating better, we have different diet plans and approaches, which include cognitive behavior therapy as well, to help approach the condition in a better way. We also work with sensory issues, the causes of sensory issues, which is a problem most autistic children have. Why is a child having sensory issues? There could be many reasons for that, and then we assess those individually and then obviously approach it. Toxins, detoxes, deficiencies, so many things are there. Like, I can pick a topic and talk about it for some time, but like even detoxes is a huge topic altogether. Why detoxify if you are autistic, and what kind of supplements work, what kind of deficiencies are common in autism. So uh, all of these things need to be discussed in detail, and every child can improve. But in general, there are some common, rules or some common facts. One of these is that the child has to be very, very I mean, the younger the child, the faster you will see improvement in their overall behavior, symptoms, delays. So we work on delays. So that the developmental delays, most often it's speech, or there is emotional immaturity. Like recently, I was reading that ADHD children may have up to 30%. Their mental age is 30%, not mental age, emotional maturity is 30% less than a similar neurotypical child of their age. So when you understand these situations as a parent, your approach to your child changes. Like if a child screams, you can't just say no and make the child quiet. You have to find the reason. If the child is seeking sounds or making sounds or not speaking or has echolalia, or the child is repeating words, or there is sleeplessness, everything has a reason behind it. There is a reason, there is a neurological reason why the child is behaving like that. And all of that approach works through gut brain axis. So this gut brain axis is an interconnected system in a body, which through an exchange of the neurotransmitters, hormones, and nerves. For example, the vagus nerve, which is the biggest nerve, cranial nerve in our body, it passes from our brain down to different parts of the body. All of this to and fro movement of information, or the exchange of information, occurs through the vagus nerve. This is one example. And similarly, there are hormones, neurotransmitters that that exchange information with the brain and the gut. So we work with autistic children on their gut for several reasons, as I explained before: toxicities, picky eating behaviors, deficiencies, gut infections, so very, very common occurrence with autism. It's a secondary condition with autism. Just today, I had a patient who has very severe eczema by birth associated with autism. So there is another condition that we commonly find in autism. Then there is gut infections, very commonly candida, or the fungal infection, or parasites. All of these are very commonly found with autism. Then seizures are there, tics are there. Um, Many of these things, we are asthma. Asthma is a very, very common occurrence with autism, and these are all related to gut damage or leaky gut. So leaky gut again is a condition that we need to control. And after that, we manage all of these symptoms through managing the leaky gut. And gut healing is a very detailed process. If you start working on the gut, once you found the like that, I'm just explaining how I work. Once I found what the possible gut damage, the gut healing can take up to 3 to 6 months. So along the way, when we start working on the gut, you will see changes in behavior. If we talk about autism, there are we all the behavioral aspects get addressed. Constipation, a very very common problem with autism, because uh, autistic children tend to hold poop or their natural urges, because either they are too focused somewhere else, or they're too scared, or they are deficient in a lot of things. So there is anxiety and all of these, and they forget to use the toilet, or if they're not potty trained, they just need to be reminded that they need to go to the toilet. So this is one very common problem that leads to gut damage. And again, hyperactivity. So we've seen a lot of times that constipation can make children hyper, and relieving constipation itself has helps children sleep better, feel better. So this is how the holistic approach to autism works. We work with natural products, natural herbs, natural supplements to help children improve with minimum damage, minimum die-off reactions, minimum detox reactions. And along the way, the whole process involves getting the child overall physiologically, emotionally, and mentally better. So this is how the holistic approach works for autism. So also another thing that I wanted to talk about when we talk about holistic approach is that Ayurvedic medicines, whether do they work or not. There's something somebody shared with me a while ago, that Ayurvedic medicines are harmful and they might not work for autistic kids. So if you ask me, you have to be selective with Ayurvedic medicine. So that is why you can't just take anything off the shelf for the brain or for the gut to heal your child, or heal as in inverted commas, get your child better through when we talk about gut. Uh, there are certain Ayurvedic preparations that you need to avoid if you are on the spectrum. And for that, obviously, you need somebody trained in this field, especially with holistic management of autism, to help choose the right product. So at Wishful Healing, we are using products that are completely safe, free of metals, and obviously herbals and supplements that are, of the highest quality. So even when we will talk about the diet part, I mean, a lot of diets are very popular with autism, like the GFCF diet is something that most parents know about autism and autism spectrum disorders. So that definitely is required. There are other diets as well, depending on, like we work with about 15, 16 different types of diets with autistic children. And depending on their needs, we have to customize a plan for them and work accordingly. So this is how the holistic approach to autism works. And how it helps autistic children is that when the gut starts getting better, say 3 to 6 months down the line, the child is feeling much better in the gut area. We also see improvement in their behavior, they become more calm, more focused, more alert. Speech also gets better, because unless and until the child can focus, they can't learn. And when they can't learn, it is harder to improve or progress, whether it's speech or learning or anything else. So that's how the holistic approach to autism works, and that is how we work with the autism spectrum disorder kids. And uh, it is a very difficult approach. We are not trying, I'll repeat again, we are not trying to treat the condition. We are just trying to provide you an umbrella, so that we can't stop the rain, but you can still walk through the rain with some protection and without getting fully drenched. That's the whole idea about managing autism through holistic approach. I want to leave a note for parents, and every day I have consultations with autistic parents offline and online. And I believe, uh, as much as it is our job to assess the child and provide the right guidance and approach, we have to put in equal effort to get the parents on board for this approach, because once the parents are on board, a lot of things get easier, because I can give you 10 things to do daily. But as a parent, if you don't believe in them, if you don't trust the process, or if you are too busy, or for whatever reason you are maybe not feeling emotionally fit for the situation to handle the child, or for you don't have enough support at home, it gets hard for the child to recover. So, as much as it's important to devise the right plan and the right approach for the child, it's equally important for you as a parent to understand that this journey is very long, and autism does not go anywhere. So every day when a parent asks me, whether the autism will go away, whether we can cure, and what do you mean by autism recovery, we are not trying to cure it. And so somebody is asking, how does the holistic approach ensure that interventions are personalized? So when we talk to the patients, we are discussing all the symptoms and all their issues in detail, and that's when we customize plans accordingly. And obviously we advise on what interventions they are already taking, if not taking, what kind of interventions they can take, and then what kind of interventions they can um, look for further improvement. Like, for example, I tell a lot of parents when they come to me that we've been taking OT or speech therapy for 5 years, but the child hasn't even learned to pick up a pencil. So there is a problem there with the intervention, right? So you have to you can't just blindly follow interventions. You have to use your brain as a parent, whether this therapist is doing the job for me or not, whether this approach is working for me or not, whether my child even needs OT or not, whether my child needs another therapy, like he might need a reflex therapy, he might need relaxation therapy, a behavior therapy, something else that may be missing in the piece of the puzzle. That is why I was just saying that this is a very long journey. So along the way, when you start catching up on your delays and with your child, when your child gets to reach his milestones, new challenges arise. So I'm not saying, or I'm not trying to scare you. The thing is that I'll give you an example. Like, when a child who has not spoken a word before 4, or there was a regression and he stopped speaking, and now he's 4 and he's not speaking, and then we put him on a protocol, and then the child starts speaking words, and we reach a point where the child is using functional language, need-based communication. So he can say, Mama, please give me water, but then he cannot initiate a conversation, or he cannot give to and fro what, where, when answers. Uh, that's where the challenges change. Okay, so we have covered a journey, but then there is a long way to go, right? So development of speech and then language, in this example I'm talking in this context, is a very long journey. So that's how the challenges change, and that's how holistic approach helps. You need constant monitoring and evaluation of the child for the challenges that come. So for all the parents, get this out of your head first, that 6 महीने में 6 months में the child will get better, or 12 in a year or two, how long will the treatment take, how long will the management take? That's not how the approach should be. Our approach has to be progress. There is, when your approach is right, there is positive progress, and there is progress, and then you will obviously see more challenges, more improvement in speed. But just like any other neurotypical child needs constant monitoring and guidance until and unless they become independent financially, educationally, in their life, or they become adults. Similarly, a neurodivergent child has a similar journey, but the approach is different. Okay, so if we get fixated as a parent that I want to find a solution or a one-stop solution where my child will be free of autism, or because somebody claimed that they can get my child rid of autism, you need to change that person or the guide you are following. In my 10 years of practice, I have never seen any magic pill or any magical approach that made a divergent child, neurotypical. Okay, so you need to get out of your denial, or you need to get out of the scare that, my child is autistic and I have to find a solution and God will give me a solution, or there will be a day or I will not sleep before I find a solution for autism, because there is no solution, there is a different approach. You need to change the approach. It's a different working system, it's a different wiring of the brain, it's a different operating system. Just like Android, I just gave an example a few weeks back on Instagram, that just like Apple has an iOS operating system, and Samsung has an Android. There are two different things, you can't compare. So you need to change the approach. Okay, so just like a diesel engine is different from a petrol engine is another example I gave. I may be wrong in the analogy, but I think you get the point. The approach has to be totally different. And once parents wrap their head around this, their anxiety goes down, and working with the child itself becomes much easier. The moment you have behavior issues, symptoms, try to look for why that is happening rather than just trying to make the child sit and stop doing that behavior, because you will not succeed in that eventually. It may work for a day or two, but it will not help solve the process. Whatever I'm saying, I know it's very, very hard to do, but the only way to get your child to progress is to address the symptoms individually and holistically. And obviously, there are different approaches. You can go the medical way, also go for medications that are prescribed for ADHD and autism. That is up to you. I would not comment on that today, but definitely I can say that holistic approach does help. It has helped a lot of children and it can help. And the earlier you start, if you have a child who's young, diagnosed just now, or if you think that your child might have autism, get them diagnosed or assessed as soon as possible, or get help as soon as possible and start working on it. The earlier you work on it, the faster and the easier your life becomes, and the more functional your child will become eventually. So, with this, I would like to wrap up today's discussion. And if there is any query, you can ask in the comments box below. We will be posting this video for viewing later on the Facebook page on Autism Connect and Wishful Healing as well. So you can go ahead and watch this in detail. You can ask all your queries there. You can follow me on Instagram or Facebook on my page, Wishful Healing, and you can ask your queries, you can book appointments. I see patients online as well as offline every day. So we are here to help. And the whole idea about this is to help the parents find positivity in their approach and progress in their child's life. The whole purpose is to make your child more functionally independent. So with this, I would wrap up the call. I'm tagged with this post as well, so you can find my page and you can post your queries, as I said. And it was nice talking. Hope you find meaning and some insights from today's live. And we'll see you around. Bye-bye.